Your unit for conducting client consultation worksheet is a 14-question worksheet. To pass the assessment, you need to achieve the whole worksheet as a minimum of 31 marks out of 38. However, you will also need to score the minimum criteria for each question which is provided below the question. So if we work through the worksheet, it should be self-explanatory. So for example, question 1, you need to identify a risk stratification model and then explain how it can be used to assess risk. I believe the one in your manuals is most often referred to is the Irwin and Morgan risk stratification model. So you can mention that one. You just need to explain how that model is used in regards to using your client's subjective as well as objective feedback. So subjective will then be telling you their lifestyle, essentially. Do they smoke? Do they drink? Do they currently exercise? Things where you need to kind of take their word on it. But also objective could be their specific age, their BMI, their blood pressure, their heart rate. And by combining these things, you can then start to assess them on a RAG rating, so red, amber, green, on whether they are high risk, medium risk, or low risk. As you go down question 2, how would you use the following approaches to support clients, whether there's rewards, motivational interviewing, and cognitive reframing. So in particular with rewards, you don't want to contradict your overarching goal. So if someone's wanting to lose weight, you don't want to promote, if you lose half a stone, you can go uptown and have a curry and a meal out and things like that. So you kind of promoting negative behaviour rewards. Motivational interviewing is a technique that you fulfill at your consultation, as is cognitive reframing. So those two are specific behavioural change strategies where you'll have to go into your Unit 4 manual and just summarise how they can be used. Question 3, you need to identify 2 other professionals to which an instructor might need to refer or signpost a client. Give an example of when it might be necessary and how it will take place. So in the first column, say who you might refer a person to, whether it's a GP, for example, or somebody else for your second option. When you may do it, so you might be that during a consultation when your client says A, B, or C, or it could be during a session when your client says A, B, or C. And then how will it be done? There should be some reference to things such as confidentiality, data protection, professionalism, and consent would be a big one as well. This question, you need to label the Eatwell guide and provide examples of foods that belong to each section. So please note there's 10 marks for this, but there's only 5 boxes. So if you only label the foods, that isn't enough. You need to label the foods and provide examples of foods that belong in that section. So make sure you get at least 7 out of 10. You've then got some multiple choice ones. So the Eatwell guide should just be a matter of clicking the boxes and you can choose your answer. And then finally, for question 11, explain 2 health risks of poor nutrition and 2 benefits. Hopefully, we can explain that after completing the content of Unit 4. Which of the following is a credible source of scientific nutritional guidance? Again, I shall leave that to your discretion. Identify 2 technologies that could be used to support a client's exercise adherence. So this is about how you could use technology to support clients. So choose one of them. Again, if you're unsure, look at the Unit 4, but hopefully there's a few in terms of food tracking apps, in terms of pedometers, using smartphones, using heart rate monitors, smartwatches, and there's quite a few variations you can use there. And then finally, there's some scenario examples. So consider the following scenario and complete the table. A client would like to lose a stone in weight and improve his or her cardiovascular fitness in preparation for a race for life in 6 months. Which fitness assessment would be appropriate? Describe the protocols for administering each assessment chosen. So bearing in mind that this person wants to lose weight and wants to get fitter, you may want to use 2 measurements, one that kind of shows that they are losing weight and one that shows that they are getting fitter. And then for each one of those, could you kind of explain how you perform the protocol? Now, we don't need too much information there. Now, the overarching marks is only 2, but it'll be good to get a full understanding from your description in there. Once you complete the worksheet, your tutor will clearly identify how many marks you've got for each question. They'll then clearly identify how many marks you've got for the worksheet as a whole, and then they will either mark it as a pass or a refer with written and sometimes a video link feedback as well.